This short video will be discussing radiotherapy for head and neck cancers. The information provided is not designed to replace the initial consultation details provided by your oncologist. What is radiotherapy? Radiotherapy uses high-energy X-rays which are targeted precisely to cancerous cells in the head and neck region and, if required, lymph nodes. Unlike normal cells, cancerous cells are less able to repair any damage caused from radiation. The radiotherapy pathway. This is the radiotherapy pathway, starting with an initial planning appointment which includes a CT scan. After the planning appointment, you will have daily radiotherapy, which is typically given over Monday to Friday. Whilst on treatment, you will have 2 review appointments a week where you will have a consultation with a doctor, nurse, specialist radiographer, dietitian and speech and language therapist, discussing how you are managing treatment and giving guidance on any side effects you might be experiencing. After treatment finished, you will receive a weekly telephone review with a nurse specialist until you see the doctor 4 weeks post-treatment. Your planning appointment. Your planning appointment will be divided in 2 halves and will last 1 hour. For the first half, we will make a mask of your treatment, which will help keep you still. For the second half, you will have a CT scan wearing your mask. The oncologist will use the scan to map out where the treatment needs to be aimed. This will be your individual plan. Making your individual mask. The mask will ensure you are kept in place for your planning and treatment sessions. Sometimes we have to make something called a mouth bite. A mouth bite is a small tube with a gummy paste around it, which you will bite lightly on and is used for planning and treatment. Preparing. You will be asked to remove all your clothes from your waist up and change into a gown. We will help keep you covered as much as possible. Remove any jewellery, hearing aids and dentures. You'll be asked to lie down on the bed on your back. We have a variety of different neck rests in order to support your neck. If you do experience any discomfort, let the team know so that they can change this for you. Positioning. The radiographers will ensure that you're lying down in the required position with your spine as straight as possible using a green laser light. This usually requires gentle movement of your body and you'll be guided through any required movements. Immersing. A flat piece of plastic with many holes is immersed into warm water. After a few minutes, the plastic is removed and any excess water is removed. The material is soft and ready for making the mask. Moulding. The material is stretched over your head and neck. Gentle pressure is applied to your head, neck, bridge of nose and shoulders. Please close your eyes for comfort and breathe through your nose. Try not to talk during this process as any movement of your jaw can distort the shape of the mask as it cools down. Cooling. It takes approximately 8 minutes for the mask to set, and during this time continue to breathe normally. You will feel a cool sensation as the mask is encouraged to set quickly. The radiographers will be stood alongside you during the mask making procedure. Final touches. Markings will be drawn on your mask by the radiographers. This helps to plan your treatment and will ensure you are set up in the correct position for your treatment sessions. Once set, the mask is removed and the radiographers will give you a break before commencing to the CT scan. Remember, you may feel anxious or claustrophobic whilst wearing the mask. If you have any concerns about these feelings, please let the radiotherapy team know so that they can do something to help. Please bring your own music if you prefer. Some people like to be spoken to throughout the process. Others like quiet, relaxing music. These preferences can be accommodated to ensure you feel as relaxed as possible. Your CT scan. For the CT scan, you will remain in the same position that you were in for the mask making procedure. The mask will be refitted and thoroughly checked before commencing. The radiographers will let you know when they are ready to leave the room to start the scan. They will watch you throughout the procedure from outside. If you experience any discomfort, please raise a hand. The scan itself only lasts 5 minutes. You will not see anything for the scan. It is very important that you keep still during the CT scan. Once the CT scan is completed, the radiographers will enter the room and remove the mask. The couch will be elevated, so please do not sit up straight away. At the end, you will be tattooed on the centre of your chest. This is a small permanent mark about the size of a full stop, which is used to get you in the right position for treatment when used with the mask. Contrast injection. Your doctor may request for you to have an injection of contrast for the CT scan. For some patients, this can be helpful to show more detail in the head and neck area. You will be informed if this is required. If you have had a contrast scan before and had an allergic reaction, you must tell the radiotherapy team before the CT scan. The injection involves having a cannula, which is a thin, flexible tube inserted into your arm or hand using a needle. The contrast is injected via the cannula. The injection of contrast will occur just before the CT scan starts. You may experience a metallic taste in the back of your throat or a warm sensation during and after the injection for about 20 seconds. The cannula is removed after a minimum of 20 minutes after the scan. What happens after the CT scan? You'll be given the date for your first radiotherapy treatment, which is usually 2 to 3 weeks later. The time in between the CT scan and first radiotherapy treatment is used to check your individual plan and make sure it is ready to deliver. This is not a diagnostic scan, so you will not receive any results of the scan. It is only used to plan your radiotherapy treatment. Your individual radiotherapy plan. There will usually be multiple radiotherapy beams used for treatment to the head and neck region. No two plans will be the same. Radiotherapy is planned to an individual's body shape and diagnosis. In the picture on the left, the yellow arrows represent radiation beams targeted to the oral cavity and neck. There are usually a couple of beams targeted to the treatment area. Your plan is always approved by your consultant. Alternatively, your treatment course may involve continuous radiation delivery as the treatment machine moves in a 360-degree circle. In the image on your right, the yellow arrows show the movement of the beam as the radiation is delivered. Your treatment is delivered in a 360-degree arc rather than multiple static beams. Your radiotherapy treatment. What happens on your first day of treatment? On the first day only, please arrive 30 minutes before your scheduled appointment time. Your first treatment will be approximately 30 minutes and subsequent treatments 15 to 20 minutes. Please use the signage to direct yourself from the main entrance to the reception area. Please check in at the radiotherapy reception desk and take a seat. This is the entrance to the main radiotherapy waiting area. Go through these doors and the reception desk is on your right. How will I know when it's my turn? One of the radiographers will come and find you near to your appointment time for a first aid chat. They will discuss the procedure and answer any questions you may have. They will provide you with a list of the first week's appointment times. They will then ask you to change into a gown. Remove clothing from the waist up only. Please remove jewellery. If you prefer, you can bring your own dressing gown. They will walk you into the treatment room and position you on the couch. The pictures here depict how the gowns are worn. The gowns are worn like a dressing gown and fastened at the front. Remove upper clothing, but lower clothing such as trousers and skirts can be kept on, as well as your shoes. Am I in the right position? Remove jewellery, hearing aids and dentures exactly as you would have done at your planning appointment. The radiographers will remind you. The radiographers will help you onto the treatment couch, put your individual mask on and adjust your body, the couch and treatment machine to the required position. Keep still and relax. Breathe and swallow normally whilst in the mask. Once happy with your position, the radiographers will leave the room to control the machine from outside. They will watch you on CCTV cameras at all times and they can communicate via an intercom. We understand remaining alone whilst in a mask can be a daunting experience. Let the radiographers know you're feeling anxious by raising your hand. They will be able to stop the machine and come into the room. A short CT scan will be given on the first few days during treatment and thereafter once a week to confirm your position. Some patients will follow a different regime and you'll be informed if that's the case. So let's dispel some common myths and patient views of radiotherapy. Is radiotherapy painful? No, you will not feel or see anything during radiotherapy, but you will hear a buzzing noise as the treatment is delivered. Will I be radioactive? No. Radiotherapy does not make you radioactive, and it is perfectly safe for you to interact with others, including children, after treatment. Will the machine move on its own? The machine does not move on its own. It is programmed by the radiographers inside and outside of the room. Its movement is controlled by the radiographers stopping and starting when they tell it to. It is also programmed to only give you a certain amount of treatment every day, and the amount of radiation is the same every day, so that you can never have too much. Can I stop and start treatment as I wish? Radiotherapy is a commitment. Treatment is delivered over Monday to Friday and over bank holidays. Once you have commenced radiotherapy, it's crucial that you do not miss treatment days, as this may make your treatment less effective. If you're unable to attend for any reason, please discuss with the radiographer or telephone your specialist cancer nurse. Your weekly reviews. Each week you will have the opportunity to meet with a review radiographer during your course of radiotherapy. Review radiographers are happy to answer any questions. They are also available via phone when you're not in the department. Patients are encouraged to utilise this forum to express any concerns they may have whilst they're having treatment. Your side effects will be monitored and appropriate advice given. Each week you'll be seen by your consultant, specialist nurse, dietitian, speech and language therapist, and the review radiographer. Managing side effects. Radiotherapy affects people in different ways, so it's difficult to predict exactly how you will react to your treatment. Side effects generally only happen in the area being treated. Side effects occur gradually, and you will not notice anything from one session. Side effects tend to start towards the end of the second week of treatment and will be at their worst 10 to 14 days after the treatment has finished. Most side effects are temporary, and generally people notice a significant improvement 6 to 8 weeks after treatment. Some side effects may last for a few months following treatment, and others can be permanent. This will be discussed during your weekly review appointment with either the consultant or your review radiographer. Sore mouth and throat. Your mouth and throat may become very inflamed if they're being treated, and this can make swallowing painful. You will be prescribed mouthwashes and painkillers to help you cope. Your specialist cancer nurse will provide you with a prescription exemption card so that you do not have to pay for medications whilst on treatment. Pain relief should be taken regularly for best results, and if you're taking any anti-inflammatory drugs such as ibuprofen or diclofenac, a stomach protectant tablet will be prescribed for you to take. Some painkillers such as codeine and morphine can cause constipation, so laxatives will be prescribed to take regularly alongside these medications. Please let us know if you're not opening your bowels regularly. Changing or increasing your pain relief and other medications will be advised during your weekly review sessions. If you're not due for review, let the radiographers know and they will organise for you to be seen by the doctor, specialist cancer nurse or head and neck review radiographer. Dry mouth and throat. Radiotherapy can make your mouth and throat feel dry and your saliva thick and sticky. Sipping fluids and carrying a bottle of water when going out or coming for treatment will help. Breathing in warm steam by using a bowl of hot water and a towel over your head can help to loosen secretions that are difficult to cough up and clear. For this to be effective, it needs to be done regularly. If this works well for you, we can arrange for a nebulizer to be delivered to your home. Often, thick, sticky secretions can lead to nausea. If this continues despite regularly clearing the secretions, an anti-sickness medication can be prescribed. Please let the team know if you're experiencing nausea or vomiting. Difficulty swallowing, pain and dryness in the mouth and throat can impact your ability to eat. Your weight will be monitored weekly throughout radiotherapy. Maintaining weight promotes recovery and ensures that your mask continues to fit well. Try the little and often approach. Try small meals 5 to 6 times a day. Ensure you're eating soft, moist or liquid foods and try to add extra cream, cheese and butter to meals to increase calories. Full fat products can be helpful to increase calories if you're eating smaller amounts than usual. Avoid hot, spicy, acidic foods and drinks such as fruit and fruit juices, vinegar and tomato soup. You will find these sting. Avoid dry and scratchy foods such as crackers, toast and biscuits. Drink extra fluids, especially milk. Supplement drinks such as Ensure will be provided if your dietitian feels these are necessary. Avoid alcohol, particularly spirits. Alcohol and smoking can make the side effects worse, and it may be better to give up alcohol and smoking completely until the mouth is healed. Occasionally, patients may require hospital admission to be fed through a tube because they're finding it difficult to swallow foods and fluids. For patients that may require support eating and drinking, your consultant may recommend having a tube inserted directly into your stomach just before or in the first 2 weeks of radiotherapy. This type of tube can be looked after at home, but does require a 2 to 3 day short stay in hospital. Mouth care. It's particularly important to look after your mouth during your radiotherapy treatment. Keep your mouth clean and moist using a non-alcoholic mouthwash, particularly in between meals. A saltwater mouthwash can be made at home using 1 teaspoon of salt to a pint of warm water. This can be used as often as wanted. Brush your teeth at least twice a day and ideally following each meal. If you're experiencing a sore mouth, it is recommended that you use children's toothpaste and a soft bristle toothbrush for a more gentle clean. Monitor your oral cavity for any white patches or coating, as this can suggest a fungal infection. This can increase soreness in the mouth and should be treated with an antifungal medication. Let one of the head and neck team know if this occurs. Some other common side effects of this treatment include voice changes. Your voice may become hoarse or weaker over time. Avoid smoking and smoky places. Talking may become uncomfortable and sore. Speaking quietly and gently is recommended, giving your voice a rest throughout the day. If your treatment includes the voice box, you may lose your voice completely towards the end of treatment. This will gradually return, but in the meantime, you may find it beneficial to carry a pen and paper to write messages. Taste changes. Your sense of taste may be altered, and you may find that everything tastes the same or of nothing at all. It can take months for taste to return, and there may be some permanent changes. During treatment, think of food and fluid as medication or a unit of fuel. Your body needs a specific amount in order to cope with the treatment and recover. Hair loss. Any hair, including facial hair in the treatment area, will fall out. You're able to discuss regrowth with one of the head and neck team. Difficulty with mouth opening. Radiotherapy can cause tightening of the muscles that open your mouth, which can make your jaw and mouth more difficult to open. This is called trismus. If this occurs, a speech and language therapist can provide you with some jaw exercises to help. Skin reactions. The skin may become dry, tender and pinker in colour, similar to mild sunburn. If the skin breaks, discontinue applying any cream you're using. Keep the skin clean, dry and ask for further advice. Review radiographers can provide dressings to soothe itching or blistered skin. But what can I do to help myself? First of all, don't panic. The radiographers will assess your skin daily and refer you for specialist advice and, if needed, dressings. You can use a moisturiser that does not contain sodium lauryl sulfate at least twice daily, but you shouldn't use this on broken skin. Avoid shaving or hair removal on the affected area. Men may use an electric shaver, but wet shaving is not permitted. Wash your face and neck with a mild, unperfumed soap in tepid water. Pat the area dry with a soft towel. Try not to rub or scratch the area. Wear soft cotton, non-collared or loose clothing to avoid friction. Shield the area from direct sun exposure and utilise a high-factor sunblock once the radiotherapy is completed for the first year, as your skin will be especially sensitive. Tiredness and fatigue. Radiotherapy can affect your energy levels, your motivation and emotions during treatment and for several weeks after. Your body will use a lot of energy over the course of treatment, and added to the travelling and anxiety of this, you may feel tired. We encourage patients to carry on their daily activities where possible. Keep well hydrated with at least 2 litres of water a day. Eat a balanced diet and rest your body when it needs it. Consider the complementary therapies offered at the Royal Berkshire Hospital, such as mindfulness, aromatherapy and massage. Ask the review radiographer for more information on this when you start your treatment. We understand you may have apprehensions during the process of radiotherapy which need addressing. Don't be afraid to ask your healthcare team regarding emotional support, financial support and other concerns. There are lots of treatments and support schemes available. You can explore options with your nurse specialist or review radiographer. Smoking can cause side effects to develop earlier and possibly be even worse. We strongly suggest that you give up smoking. For support and advice on this, please talk to the specialist cancer nurse. Your follow-up appointment. So your radiotherapy is finished. What next? You will receive a letter for a follow-up appointment with your oncologist in the ear, nose and throat clinic approximately 4 weeks after treatment finished. So your specialist cancer nurse will contact you by telephone each week prior to the follow-up appointment to see how you're doing. If you're struggling with anything or have any concerns, don't wait for this telephone call and call her and leave a message and she will contact you back. It can be normal to continue taking painkillers after radiotherapy for at least 4 to 6 weeks. Your specialist cancer nurse will provide ongoing advice on how to manage your medications. For all inquiries, contact us on 0118 322 8869. This will get you through to the radiotherapy review radiographer team. If you want to speak to the head and neck cancer nurse, the contact number is 0118 322 8827.